Hi. I have no idea what she is doing. She's leaning over the bed. Hi everybody, it's Matt and Dyan and welcome back to OK Aussie. What are you doing?
Oh, for goodness sake.
The stuff that she does.
Stretching.
You were stretching. That is actually a very good self-propelled static stretch. Well done.
My mattress is a bit high. Stupid.
My mattress is a bit high.
It's stupid.
My mattress is not level to your mattress.
Very spongy.
No, this is a problem when you actually have a companion bed, but you also then have disability mattresses.
There's a big crack down here, and everything gets lost, and it's like...
I know. It's the crevasse, actually, to be honest. Hope you guys are going well. It is a Monday.
Stay on your side.
What a friggin' Monday.
What?
No, what? You didn't even know it's Monday today. I'm just saying.
I thought yesterday was Monday.
She thought yesterday was Monday.
And
well, today is Monday.
And today I thought was
And what a Monday's been.
But today I thought was Sunday. Legit.
How can you get them up?
I don't know.
Oh my God, she does things back to front. She's broken. She started the day off at before 4 o'clock in the morning. Tell her off. Tell her right now, go back to bed.
3:45, I woke up and I went, I'm awake.
Yeah, 3:45. Thanks for being so precise at the lack of sleep that I didn't have. I am so exhausted. I almost fell asleep on the way on the freeway today. I'm that friggin' tired. But that's our birds. Our bungees are over there talking.
Gossiping.
All they do is gossip. Now, I'm glad you did a stretch. This arrived today. I'm showing what's in the box. What's in the box? Well, this is actually something sometimes better than a stretch. It's a massage gun!
It scares me. It's intimidating.
I spend a lot of time having to do
intimidating.
deep tissue, shiatsu, gentle massage, traction, pressure pointing. I'm getting too exhausted. I need someone to massage me whilst I'm massaging you. That's actually weird. No, don't feel bad. This is incredible and actually really well priced. Again, not sponsored. I'm just simply showing you the things that we get and do. It's the Spectre 1000 series. Actually, it's not what it's called. It's simply called a Spectre massage gun. Okay, it was less than $60. Comes with a case. Comes with all these attachments, all these different heads. It's the ones that the chiros and physios. The attachment simply goes in
basically what it
like
does,
that.
If when you've got fibromyalgia, guys,
power at the bottom.
I should say, if you have loss
control, press the.
That looks like. That looks like a gun.
Speed gun.
You're speeding.
Speed gun.
You're speeding, asshole.
Okay.
Right.
And there's different settings.
Pull off the,
let's turn that off for the moment.
And...
She does. So that arrived.
What I wanted to say was...
What did you want to say? Because you got me working.
You want to hear.
Oh, do we want to hear? Okay, let's listen to Dyan now. Yes, darling. Matt's a bit tired and irritable. Matt's going to sleep.
I need my other husband right now.
Well, that would be nice.
Basically,
I need one of those too, just to help me out.
Listen, right?
Yep, we're listening.
If you have Ehlers-Danlos,
and
it causes your... I look like shit, I know. I'm not well. I'm still not well.
Well, guess what? You do a really good job of looking unwell, which is actually pretty appropriate considering you got 22q11.2 deletion syndrome.
Normally it doesn't show. But anyway. Because of my joints being so hypermobile,
popping in, popping out.
I get very, very painful muscles, and particularly in certain weak points. And my spine is collapsing, and it's part of 22q.
CCI.
I'm 50, right? So I've got CCI, which means my neck is collapsing.
Neck stuffed.
So sometimes I just get like a crook in my neck.
Yeah.
And it gets stuck, and it can be stuck for 2 weeks.
Oh yeah, absolutely.
This is
to relieve the muscle tension,
so what it
the lock.
Is you just
Unlock.
hold it on the muscle that's locked.
Yep.
And hold it in the main part of the muscle.
Yep.
For as long as it feels, and you'll feel this sensation of relax. Another thing,
good vibrations.
If you've got the money, but I don't have the money, is I used to get acupuncture.
Yeah. No, I've offered to put needles and pins into her and everything, but she just... No, I actually do pressure pointing, but without the needles and the blood and everything else. So
you are not touching me.
I'm not putting needles in. Jeez,
you've already done that.
Paranoid now.
When you do. Oh, we're going to make that little bit for my.
Oh, we've got so many things to make. I want to go to sleep. That's how it feels like when you've been up at 3:45 in the morning.
It's really difficult.
So what else do we do today? let's explain this.
What did we do today?
If-
I can't remember.
Oh God, she can't remember. So yes, that came in the mail today. That was one of the
And
things
your
that came in the mail.
guitar.
My guitar.
It's super cute.
Let's say hello to the guitar. Hi guys, how are we going over there? Okay, that's the two budgies over cheering, chattering. So my guitar finally arrived. Got this from Big W. Amazing price. It's like about $83 for a guitar, steel strings, spare strings, the stem, 2 plectrums, a little vinyl case. Not bad for $83. So anyway, I haven't played the guitar for decades. I thought I'd treat myself and try and do something different to get back into it. I used to play every type of different types of guitar, so I thought I'd start slowly and get into that. Anyway, that was one of the things that came in the mail today, didn't it? We're waiting
not
for...
my Shein.
Not her Shein order, apparently. Now, guess who's meant to be coming tomorrow? Yeah, the plumber. Okay, so the plumber better bloody well come tomorrow. Seriously, I am so over that friggin' plumber.
You know what?
He's coming tomorrow.
Happens,
Until it happens.
it's not happening.
Yes.
But guess what my Shein order is, everybody?
Yes.
You've...
Yes.
Actually, no, I don't think we've shown them the gems, have we?
No, we haven't. So while we're talking about that,
Oh,
you've got
well,
shoes
yes,
coming.
but like,
Shoes coming.
so
Shoes.
basically...
Yes. Where's she tucked around that corner?
It's an awkward question.
It is.
It's all right, chickens. Daddy didn't mean to spill your water.
I didn't spill the water.
He didn't spill the water. So I've got 7 new pairs of shoes.
What do you need 7
Okay.
pairs of shoes for?
Because
You don't walk.
True, but they look nice, and it's
I'm
civilized.
exasperated.
You have to wear shoes. It's civilized. Listen to this.
I'm listening.
Because they cost $10 to $13,
Yeah.
and they have feminine sneakers.
Good.
Anyway, you wouldn't understand. And they also have some nice summer shoes
Okay, what's cool?
that actually fit me. Because in Australia right now,
that is a challenge.
you listening, Australia?
That is a challenge.
Kmart, Big W, everyone.
They don't have her shoe size. She's
I'm
so
not
small.
even a
She's got
7.
little itsy bitsy
No,
feet.
but they only have, sorry for my little pimple patch, they only have size 7s.
Mm-hmm.
I'm a 5.5.
Ah, keep me up to date on this. How's this going, by the way? Check me, pulse oximeter.
I'm 5.5, but they only stock 7s.
Yeah.
That's discrimination against small people.
Yeah, I'm going to be very interested in seeing your report because
I
I know
know.
your oxygen stats have been low today. I know your heart rate. Okay, don't need to
96,
cough now.
it's been quite good
Right,
from what I've noticed, but many times not
dropping
good.
off, yeah.
But heart rate has been
We are
predominantly
monitoring
low.
Dyan's
rather than high.
saturation of
I've
oxygen.
been doing nothing.
Seeing what her heart rate's doing. She
I'm
has
doing
been
nothing.
horizontal,
But I'm
resting.
still being
Nothing.
low oxygen in
It
the
sucks.
80s.
Literally, you're
Not good.
sucking to try and get air in at times. So
Yeah.
it's really stupid, her body. Her
Having
body's
a
broken.
shower, not often enough.
Nope.
That's why the bath is needed.
That's
That's
gonna be
why
good.
the bath is getting done.
That's also good.
But we're not going to talk about the bath until it's done because
Yeah, don't
I
jinx
am
us.
so sick of this. This feels sticky.
What's that? Well, why? Ugh. It actually. Why is it so sticky?
I don't know.
This is a sensory thing, a
It's a
toy that
smiggle
she's
one
got, a
too.
schmiggle, but it's actually. It's sticky. Did you say it's sticky? Yes, it is
Jazzy.
sticky. Anyway, so that's that happening. That's another thing I just wanted to update. Now, I have been in touch with her doctor. We've got a urgent medical appointment tomorrow morning with him as a telehealth. I have been in touch with Outpatients Direct. Outpatients Direct, OPD, are the place where all the referrals from the medical system go to. So you go to your GP here in Australia. They send referrals to the central referral system. Outpatient Direct manages the outpatient system, and Dyan's got about 20 different plus referrals to different specialties at the main hospital. And I went through today to find out, well, what coming up, what specialities is she meant to be seeing? Are they face to face? Are they over the phone? Telehealth, those sort of things. Are there tests that have to be done before? All these sort of bits and pieces. I'm just trying to work out scheduling because, hey, that's pretty full on. I also went down to Humdrum today. Humdrum's our local provider in the disability sector that's very local to us where we are, to look at some new staffing because we're trying to get some nursing staffing to be able to help
Sorry.
us. You're zoning out.
Because, like, yeah.
Why?
But, I don't know. But basically,
You're in happy hour?
no, I've had to double my dose, haven't I, for a while now of my seizure.
Yeah. And how's that making you feel? Guys, that's not helping.
You can hear the birds in the park.
Inside toilet.
It's feeding time at the zoo, guys.
When isn't it? Yeah.
Jazzy. But basically, like, the medication makes you feel yuck.
It does.
But I can't stop taking the medication because a seizure can affect my heart and vice versa.
Correct.
So I'm in this entrapment situation where
It actually
luckily
sucks.
my heart medicine doesn't give me side effects, but my seizure meds, my Eplum, make me and so the more I have, the more
because it actually is a mood affecting medication.
And there's nothing I can do about it.
And
so
you have to
I'm
have
not myself.
much higher dosages to try and get in control of the seizures as you've been seeing. If you haven't seen them, go back and have a look, or have a look at our playlist. We've got multiple playlists for different things. Dyan's been dealing with a lot, but her seizures are changing. The more the medications increase, the ASMs, the anti-seizure medications, then they are less frequency, they are less duration, they are less severe. They're all good lesses, okay? We want to have less. Less is best. We'd actually like to have a lot less, ideally.
It affects your mood.
Correct.
And even the day after a seizure, your mood is affected.
Oh,
but that goes away. But then you've got the medicine one
it affects your neurology.
that stays around. And because I've increased, I reckon I must be getting used to it. I don't know, but compared to when I first went on it, and it was a miracle for me, and I'm a microdoser person, so I only need microdosing. I only need microdosing because I'm chemically sensitive, which is a good thing for me. But unfortunately, I hit that point where my old level had to be doubled.
And look,
so
Eplin is not the only medication that Dyan uses. She's got multiple medications that are working in conjunction with each other for different types and different components.
That's the one that makes me feel
well, look, we'd love to increase the medicinal CBD, don't get me wrong, because it's friggin' brilliant for pain, inflammation, nausea, anxiety, sleep, and seizures.
See, in Australia, those
medicinal
two, like
CBD is good for about 240 different things.
CBD and melatonin in Australia is extremely expensive, guys.
Compounded medication.
Zero is covered by the government, and it is all used.
Because it's not under the PBS system, the pharmaceutical benefit system.
It is actually the most natural choices, and of course, I'm all for that. And I know by experiencing them, I'm all for that because they feel better than the chemicals. But unfortunately, I can't afford it. Can't afford it.
So in other words, we have to moderate pace and obviously only use a certain amount that we can afford to use.
Affect you. You're not the same person.
And we've been noticing that, and we are mindful of that, but we can also do other things to compensate for that.
But no one's ever really realised that with me with medications through my 22q days, you know. I am very sensitive to medication.
And look, a lot of autistics can be, I'm pointing that out there. Also people with things like EDS and also certain chromosomal disorders, they can have the reverse effect for no medications. You know, you might take, as an example...
I know, with my ADHD with Nurofen. It took me forever to convince my doctor, my GP. It's not just a GP. He is my main practitioner, but basically, he didn't believe me when I said... When I take Nurofen, my blood pressure drops. There's no, it will rise.
For most normal people, it should actually increase
and
rise.
rise. But I'm the opposite. ADHD is common.
Prepare for opposite reactions if you've got some of these conditions. So we have to be prepared, and that's why we do the microdosing. Small amounts, small changes, small modifications, measure everything
to it, don't we?
So that we can quantifiably see what works, what doesn't work, and what does cause a reaction.
And it's horrible because I have to do it for safety, guys. But the quality of life, I don't know, it sucks.
It does suck. But as a positive note, to try and cheer her up, she sent me on a journey.
My Shein shoes
I'm not worried about Shein.
Tomorrow.
Over Shein.
What did they think about my rocks?
I haven't had a chance to show them the rocks. She'll chatter. She doesn't stop, this girl. I've showed the guitar. So I'm going to show you some of the gems. We've had a bit of an increase in our gems. So once we did that recent gem video, go back and have a look at that one as well. We've sorted and categorized all of the gems that we do actually have in our system, which is really important to categorize them so that we can then actually determine what we have and what we don't actually have. So in here, you can see that we've actually got our original gems and all clustered and collected. Dyan has been able to add through Shein, which is a fantastic source actually, for getting more and more of those, even more, which is what some of the ones that she's been wanting to get hold of as we work on it. So anyway, that's just a bit of a sneak peek of what she has been doing in that space alone. I'm changing the decorations and moving things around. I'm going to get myself into trouble, and especially with someone who's OCD. When you see, don't tell her I touch things. Don't tell her I move things. She knows to a millimeter if I've rotated, moved it. Pretty much. See, she can even hear me. Her hearing is like a bat. See, she can still hear me. Shh. Anyway, so she set me on a journey to our favourite shop, IKEA. Yep, there's the evidence right there, dead in the middle of the map. It's going to go here. What is it? It's a glass display cabinet, and Dyan has got a rationale. She's got some reasoning. Listen to the reasoning. Here we go.
I might need my Jesus candle.
No, you don't. You can just get on with it. Hurry up.
So, forgive me, Father, for I have sinned.
Okay.
I have too many unnecessary items.
Too many unnecessary items.
Essential.
Not essential.
So, just know, I understand that they are not of significance such as life itself, okay?
Yeah, so not as important on the scheme of things.
No.
I did bring a crate in from our outside shed so that she could put some of these things away to free up space.
Permanence freaked out and said, no, forget that I have it.
She freaked out. Object permanent. When something disappears, where did it go? Why did it go? Why is it missing? So Autistic 101.
So basically, I said to Sir, if you want me to continue to participate, which I want probably more than he does, I want to participate in cleaning because I'm stubborn. And I like to clean. Yes, I'm like that.
She has problems, including cleaning. Not a bad thing.
No, I've been cleaning since I was a child. And basically...
Yeah, but your parents were like Cinderella and the ugly stepsisters and all that, but that's another story. So let's not go there. That's a negative thing. This is not Disney.
But basically, with the cabinet, the goal is all of my knickknacks are going in there. And they're going to be all on display in all different categories. And I'm going to have to get dividers so that most of my spaces are clear, so that it's easier for me to clean and quicker. The size of the house is perfect for me, which is what I appreciate. And the cabinet will keep them dust-free like longer.
So that's the theory behind all of this. Now, she is a collector.
But
she has multiple collections.
With all the neurological changes, I get myself very stressed out very easy on the smallest of tasks.
Yeah. So this process will help you. So my next stage, apart from having to do a long trip to IKEA and a trip to Humdrum and some food, and shopping.
Yeah,
I've been out and about a few too many times today.
I'm pregnant, like.
No, it's just dietary change. Your body's screaming for certain things, which it needs to.
I've just said to him, like, it's so intense that I can't resist it. Like, please get me this or that, and it's been like just weird things, and you know, so yeah. I've just gone with it because I thought, well, what does my body want?
If your body is craving something, it's for a reason.
It must
you need to listen to your body. It might be a certain type of...
And I've been sticking to keto.
You know, food type or grouping, which might provide some sort of thing, whether it's energy or a particular type of vitamin or potassium or sodium or whatever it might be. So listen to your food cravings. So go with your craving. Normally it's meant to be for a reason.
There's always a reason in your body.
Right, my job right now is I'm going to rip that box open. I'm going to build another IKEA cabinet. You realise that our house, our apartment, in fact, all our houses for the last 30 plus years, we've been together for more than 33 years. Yes, we have been married for more than 30 years. Just think about that for a moment. I'm the one that needs help, not you. So, we've had multiple houses in that period of time, living in different things. We have always used IKEA. It's always been easy to put together, it's always convenient, it's modular, it's affordable, it just takes a bit of know-how in putting it together, and I've become a bit of an expert in putting IKEA furniture together. So much so that people ask me to come put their IKEA furniture together. No, I'm not doing this as a side hustle. No, thank you very much. But anyway, I'm going to build this cabinet, and then it's going to be over to Miss to do her next task, which will be to put stuff in it.
Yeah, and basically I think what I'll do with you guys is I'm going to show you it of what I've done, because I am too stressed to do it on camera, and it's not you guys. but neurologically, I'm not, put it this way, I'm not accepting what's going on at the moment. So I'm frustrated. This isn't the normal me, and I'm adjusting to something very quickly, changes that have happened very quickly. So
Indeed.
I don't really want to show like that side of me of being like, so literally I could end up in a meltdown. So I have to go slow. I have to take deep breaths because this is
Good planning.
I don't know how else to explain
It's
it.
good
but,
awareness,
like,
and it's good that you're doing
neurological
that.
changes to your brain
Yeah.
affect your like executive function.
Okay. And again, if you're new to the channel, Dyan does have 22q11.2 deletion syndrome. It's an umbrella term with chromosomal disorder, which affects over 180
so
different
sticky.
parts of her body. And that includes symptoms such as autism, ADHD, OCD,
Ew.
Tourette's, all these different types of seizures, GI tract related issues, skeletal issues, hypermobility. Oh my God, the list just goes on. It's frustrating, but that's what she's dealing with. So she's being very sensible from an autistic perspective to look after her. So let's see what happens. Okay.
No.
You're a freak. Now,
Do you want to see my new space?
no, what we're going to do is actually focus on what I'm
Look
about to
at
talk about,
this.
dystonia, okay, and can be seen
really-
quite a lot with autistics. Dyan, naughty Dyan, bad Dyan, just said this statement. I haven't told you for the last week. Sometimes I just want to smack her. Okay.
Could be temporary.
Could be. Now, dystonia is a neurological
How do you know it's
hyperkinetic
that?
movement disorder because we've had you diagnosed with dystonia before. Okay, it's a movement, sustained or repetitive muscle contractions which occur involuntary. Okay.
Right?
They result in twisting, repetitive movement. So this sort of action, okay, this contraction action, things that you've got no control of. Now, sometimes we can see this around seizures. Sometimes, to me, I see it post seizure activity with these involuntary contractions. Now, the movements may resemble a tremor.
Okay, so when's it going to pass?
It's often intensified or exacerbated by physical activity. So, what was she just doing? What was Silly Billy just doing?
Oh, squeezing hard.
Oh, she was squeezing hard.
Especially to get the little ones inside.
And that's then caused this contraction, and even though she's not doing any action, the body is still doing it. So anyway, just wanted to bring that up. It is something which we've seen in the past. It is actually on your medical sort of list.
This is what my hand is like right now. And it hurts.
It hurts, doesn't it?
That stupid ball is going
yeah.
away.
Now, that's a good thing. So stopping the activity which exacerbates it, probably not
What
a
am I going to do?
bad
Most
thing.
of my
Okay.
most of my fidgets have some kind of hand movement.
We can do physical therapy. We can stretch these out
No,
and
but
counter
it makes
stretch
me
the action.
focus.
I get
the
that.
faster my hands move, the slower my brain is. And the more I can get things... I can't take Vans because I have
No, for
seizures.
ADHD, that doesn't help the situation. It's not going to help this. Okay.
No, but what
a clonazepam, like a muscle relaxant, can
what
actually
I'm
help this
saying
sort
is
of
if I don't
contraction
have
thing.
my fidgets,
Yeah.
then I can't
Sure.
concentrate.
But fidgeting is different to things that are actually causing contractual activities. Okay, so actually
Most
just doing
required,
minor
isn't it?
motor skills may not be so bad. See, even the birds are telling you off. What I'm telling her off
Anyway,
is, and
it
she's
might
really
go
bad
away.
at doing, is
It could
not
go away.
telling me when she has certain new symptoms that she's not aware of. Now, sometimes they linger in the background. This, between alexithymia, but more with interoception, the unawareness of internal states for an autistic, is really, really bad. It's really hard for me to go, and then she just goes, you're meant to know. It's like, sorry. How was I meant to know? Because you didn't use words to parlay, to explain, to express, to tell. Did you? Anything else weird I need to know?
No, just I thought it was a cramp.
Okay.
I mean, how do you know the difference?
Now, there are different
cramp is
times,
a cramp.
and we can see cramps that come in, particularly around myoclonus as well, and particularly if it's salt
What?
reductions. But
Take a look at my hand. Why won't it move?
why won't it move?
Touch it.
Not
Tell
a cramp.
me.
A cramp is not so much. I'm telling you.
I'm going to be biased.
Anyway, I've still
This
got.
is a science experiment right now. Take the opportunity.
I would say put your hand in hot water at the moment, warm water.
Oh, really?
I would actually.
Well, not with this
But
one.
not with a device on. But we can always take that off and do. When we take it off and disconnect, it creates a secondary
How are you
recording.
gonna do that with this finger that's jammed down there?
It is jammed down there, isn't it? Okay, that's actually a lot of hyperflexion. I don't want to
You're
hurt you.
hurting me.
Right, there you go.
And see, that feels like you're bending it backwards.
Yeah, it'll be interesting to actually do alternating hot-cold therapy with you between soaking in hot water for a couple of minutes and then jumping into cold. No, just in the basin, just putting your hand down. Anyway, dystonia, just a conversation. Thought we'd share it while we're having this.
Does anyone else have it? Can you just tell me what to do?
Stand on her head. We'll try a few things. Anyway, back soon. Okay, so what are we doing?
It's not getting under the thumb.
Okay, keep it underneath it. So the water at the moment is actually in a mildly hot. It's not boiling, but mildly hot position.
It's not getting in the cracks.
It is, just by soaking in it, it is actually doing that.
No, okay. I can feel this like bits where it's not getting in it. It's just really annoying.
Okay, and your body is shaking.
I don't want to touch it because it's like touching like a you know when you have a hand that's gone to a leg or arm that's gone to sleep.
Okay.
I don't want to touch it.
Okay.
It's creepy.
Creepy.
Okay.
All right.
I don't want to do that. I'm phobias.
Okay, you have phobias. Okay, right.
No,
it's okay. It's okay. Now, we're just going to experiment. I just want to see. Now, can you rotate your hand?
No, I just hide it away until
can
it goes away.
Okay. Hide it away until it goes away. Not tell anybody that something's going on. Not explain that I've got a new symptom. Not explain that I'm in discomfort. Not explain that I'm in pain.
There's under that thumb.
It's okay. You're a thumb.
It's like it's super glued.
Okay, you're actually absorbing in the water.
I'm a retard.
You're a weirdo.
I'm a robot.
You're a weirdo. Now, can you wriggle anything?
No, it feels frozen.
Which parts are locked at the moment for you? Explain. So, thumb, I'm going to break it down slowly. Your thumb, all fingers are curved at the moment, not moving. Right, relax.
From the heel of my palm down.
Okay, so what I'm going to do now.
I don't even know, like.
Okay, I'll just switch that to cold. Now, it's not freezing cold.
It is freezing cold.
It needs to be cold.
I'm going from hot.
Yes, you're going from hot to cold. I'm just trying a nerve and circulatory response. Why are you doing that? Are you okay? Do you have problems?
It's spraying on me, dude.
Okay, let's reduce the
birds are excited.
Because the birds love water. You might not. Well, you actually do love water. Now, let's go back to warm.
Oh, you're really teasing me.
Oh, no.
No.
Okay, that's fine. It's tepid. You'll feel funny because you've had it under cold. Just bring it underneath it. Bring it underneath it. So do you feel nerves inside?
Yeah.
Okay. Can you move anything at the moment out of interest?
They feel like they're getting floppier, but I can't move.
So it feels like they're getting floppy. That's good.
But I can't move
That's
them.
okay. I don't want you to try. I don't want you to try at the moment. I want you just to relax.
It feels like the frostbite thing, you know?
Yeah, I do. It's okay. So we're actually going to do 2 minutes of hot and 1 minute of cold. I just want to try something. I just want to see what's going on and why. Does it transfer up to your arm, through your wrist up to your elbow? No, so it's purely from the hand. The weird stuff that she gets into. This is happening in real motion at the moment. Not something I expected for us to be doing today. Okay.
Can you get the water under my thumb? I can't do it. It's creepy to touch my thumb.
Okay, alright.
Oh, that's weird.
That's okay, I've got it. Now, none of your fingers or joints feel like they're out at the moment? They're not sublux because of the EDS?
No.
Okay.
It just feels like it's...
Okay. I'm actually just gently massaging your hand with my fingers. How does that feel for you?
Creepy.
Okay. And cold.
Ew.
So I'm switching across to cold, taking it off hyper cold. So just cooling it down now.
I don't like it.
I know, I get it. Have you got any movement of your finger and your thumb? Has there been any change in your tactile response?
Little.
Okay, so there's some little response change.
Okay. It's really cold.
I know.
It's a penguin, it's not for me.
It's a penguin. Okay, that's statement. When she says the penguin, she means she's very cold. Okay, we're just going to rotate the hand. Okay.
Can you just do it? I don't want to play.
I'm going warm one more time. Warm one more time. Warm one more time.
Fuck.
Yes, because it's a big change. I get that.
Bitch.
Smile through it. You're doing well.
It's too hot. This water's burning me.
I've tested the water. It will not burn you. I promise you.
It's burning
It's a
me.
sensation response because you come from cool to hot. It's not going to burn you. My hand is here as well. There is no hypothermia. This is warm. Okay, so we're in the warm mode at the moment. And I'm just going to temper it down. So I'm just going to try and bring it back to a neutral temperature. Just try and wriggle your fingers for me. Just try and move your fingers.
I am trying.
You are trying, but you've got no movement still. Okay, stop the water sensation. Okay, explain what's going on.
You tell me.
Hi, there's your hands and your fingers. What's the sensation that you've got at the moment?
It's throbbing.
Okay, and that will be explained because, again, hot cough, hot's going to open up the vasculation. You're going to get blood flow going through. You're going to feel like you're pumping, you've got circulation, you've got blood flow going down.
Yeah.
If I do a Blanche test just by pressing down on your nail, good. So you've got good blood return in your finger now, okay? Can you feel my fingers just going across the tips of your fingers on the inside?
Yeah.
Yeah, you can. You can feel it. Across the thumb, you can feel that. Okay, from a movement perspective,
Feels stiff, and I can't do that myself.
okay, so you got no muscle tone to be able to move it yourself.
No.
So no strength to be able to hold. Can you grip my hand? Just try and squeeze my hand for me. You're making an effort to squeeze? Have you started?
No, I can't.
You can't do it. Okay,
I
that's
can't
fine.
move my fingers.
Right, into the hand towel. I just want you to dry that with your other hand, your supporting hand.
It's creepy.
I know. Okay, let's bring you back to bed. Take the hand towel with you. You need to support that. Okay, weird stuff going on. This is abnormal. Haven't exactly had this. Okay, dystonia. Yep, we understand. Causation. What do you reckon's caused this?
I don't know. I'm not a doctor.
No, well, that would be nice to have one of those around. Hey, any doctors in the crew? Love to hear your comments and your thoughts. What we do know is just beforehand she was doing a lot of this extensive squeeze action.
I've been getting this a lot, but I
for about a week,
let
apparently. Not telling me.
Like I just let it be, and it just comes back.
Right.
I don't even know, like the time, not long.
Now, the contracture, tendon contracture doesn't extend into fingers and hands. There could be an element and aspect of that as well.
Sometimes I'm like this and it sweats in between that crevice there.
Right, so you're in contraction
Sometimes like
positions,
that.
which is causing you to have that tightness.
Yeah.
It's feeling stiff.
And it sweats in there. It's gross.
Correct. So it's contract. So it's out of your control. You don't have that ability to control it.
I feel weird to admit I'm out of control because it's like, how can I not be in control?
Because this thing here is doing it all, but you've got no messaging to say, I want to do that action. It's out of control.
Do it.
Okay. Well, another thing for us to report back to the medical team on.
It feel like really weird.
That's okay. I wanted to see what that sensation was like. I also wanted to see what would happen to your hand in that response. I wanted to also counteract that to see, well, look, it's not circulatory because of obviously the very, very low blood flow. Tell me about it. But the weird shit that you come up with, so it's not circulatory. We know that she's got really bad heart rate at the moment, and I was worried about pumping blood to the extremities. We're going to be putting that back on because I actually need to get some results for the team. So sorry.
Well, you're going to have to dry.
I'm going to have to dry your hand. All right,
it.
back soon. How are we going?
My body is dramatic.
Just a little bit.
I'm angry.
You're angry at your body?
Yes.
Because it doesn't do what it's meant to be doing?
Because I've got things I'm supposed to be doing, and this just wants to play all this game with me.
This hand that's...
It's halfway relaxed.
So after the water interspersed treatment, we've actually regained half movement sensation.
Half. Not all.
Not full, but that's interesting. Now, of course, if we were able to do it more prolonged, maybe it would actually help in a long time. But anyway.
Let's just get on with it. You know
I've got IKEA to build.
I could just pick up the plastic stuff with that side, and if it falls on the floor, I just don't care. I don't care. I really don't care.
You do care.
You know what?
It's your specials.
I don't.
You do care.
No.
You do care. And you know you care. You know you're very frustrated, don't you?
I am not a sitter. I'm a doer.
Okay, and it's pretty hard to be a doer when your body's not letting you do.
I've got things I want to get done.
I know. That will happen. For the moment, we just got to treat each different thing as it occurs. Now, as I said to you just before, you're also high seizure risk today. waking up at 3:45 in the morning. Poor disruptive sleep.
Not sleeping.
Not sleeping. You've had migraine medication today, haven't you?
Yeah.
Yeah, so rizatriptamin's been applied with pain. Her pain levels have been high.
My wrist is tensing up now without water, so the water was doing something.
What does that mean, darling?
Oh, nothing.
Hate it when the
Have
experiments
you ever
work.
noticed me do this?
Wrap something up? Yeah. I'm very observant
Have
to
you seen me do that?
to doing weird stuff.
Yeah.
Exactly. She's a weirdo.
Because he'll make a big deal out of it.
I'll make a big deal out of it.
Yeah.
Like I'll tell your doctor and he'll go,
You are not
why
going to
did
tell
you...
him. No, you're not. So in the morning, there's enough to discuss.
Isn't that convenient? We have a
There's
doctor's
enough
appointment
to
at 8:45 in the morning.
You're not going to bother him with that.
Not going to bother him. I think he wants to know.
Because you'll be like, oh my god,
Yeah, she
it's
needs
too
to
much
know.
information.
And we also
though.
need to look at
He's a human,
we
not a
need to
robot.
look at side effects of certain medications, increases medications case as part of any side effect list.
Oh, I'm not increasing
We need to see
it.
whether this is tied into subdued
I'm
seizure
not
activity
increasing my
neurologically.
seizure
We know of
meds.
dystonia that she's had this. She's had it around Todd's paralysis, more so in the lower limbs rather than being the upper limbs.
Yeah,
She's
but if-
acutely frustrated at the moment. She really
Because
is.
if I have any more of that medication,
Yeah.
you know how grumpy I get. And
I-
so does he.
I do, but I'm the one who has to deal with it. It's okay, but him, the doctor, I have to be the one who has to deal with it day in, day out. My life sucks. It really does. Oh, gosh. And I still have to go and build IKEA, don't I?
I guess I'm on the street for sale.
On the corner. Off you go.
And he missed the bulk pickup.
Oh, that's another
We have to
story.
find
Not me,
a
it's the Shire that
Shire's dodgy.
didn't communicate about
They
bulk
don't actually
rubbish.
do bulk pickup. You
Once
know
a year, I
what?
think, these days.
It's got to be a
I have to go
minimum
find a local
length
tip
of
now.
1.5 metres.
Yeah, okay.
In my day,
Right, good
right,
distraction to the hand
you
that's
could
wrapped
put a
up.
whole tree there.
You
yeah,
could.
that doesn't exist anymore.
No, it doesn't exist. If you
And
wrap it
you're
up,
not telling my doctor.
it will be.
No, there's more important things to discuss.
That's all right, it's on the list. He loves hearing all your stories.
He'll just go, oh my god, she's a drama queen, just ignore it.
Yeah, I'm sure we can ignore that one, as long as it doesn't, extend up the rest of the arm and do other weird things. Anyway, back to building IKEA. So are you trying to show that you're the same size of what this
I'm the same size
glass
as this.
cabinet's going to be? Or are you trying to show crime scene investigation that if your body goes
Ew.
missing, that we put you into a box?
Oh god, I'm stuck.
Okay, well that's because your
This is my
hands,
dodgy
your
arm.
dicky hand's not working. That's also your dicky shoulder. We don't sublux and dislocate that.
That's why I use muscles.
Oh,
Muscles.
build those
Look
muscles.
at my, look,
You don't have any.
show them my muscles.
Where is it?
Pull it up.
Where'd it go?
That camera up.
That's not a muscle.
Ready?
What? Where? Ah!
Oh, is that your...
That was my toe.
Ready?
Yes. Where is it? Where is it? What's that?
There.
What's that? Okay. For someone who's in bed all the time, you don't have any muscles.
I don't have any muscles.
I've got a sore toe. I'm just
sorry.
saying. I've got to build something. Here I go. That's what we're building. Stick around. Let's have a look what it looks like.
Ignore the pimple patch. Look, still dealing with that. But basically, okay, he can talk Swedish all he likes, but basically it's a glass cabinet. Okay, and the glass cabinet is going here. Right? So I've got to fit all my shit into that tower. Yeah. That's the bit that's probably what we would call impossible, but we're going to make it happen because life's changed. Yeah, so watch this space. He's good at this. Wait and see.
Alright, so like an iceberg melting away, Dyan's arm is very slowly regaining some capacity. Hasn't got control of her arm fully, but we're getting some progression. She's in bed resting up. Now, in the meantime, with the big IKEA project, as always, I've laid everything out before I start. Makes it easy to access. I've also confirmed before starting, do I have everything I'm meant to have? Because the last thing you want to do is get stuck into a project and go, oh, I'm missing bolts or parts or things like that. So I always do a quick little check. have everything laid out, all the parts ready to go. Makes life a lot easier, to be honest, to get the job done. Okay, it's coming together. She's not coming together. She's falling apart, but this is coming together. There's got to be some sort of correlation to this. Maybe she should be in flat pack from IKEA. I'm sure I've got an Allen key for you as well. Anyway, no, she is actually easing off on the dystonia. It's starting to reduce its contracture. Pain is subsiding a little bit. We've had the first lot of the evening medications with some extras thrown in for good measure based on the conditions and the symptoms, the poor thing. I'm making some good progress with this. Stay tuned, we're not far away from getting it done. So a quick little update on you.
I'm so fatigued, guys.
You're looking zapped.
I've got to stay awake till bedtime.
Oxygen stats are 94, heart rate's 55, 54.
I'm shattered, guys, so.
Yeah, not
It
good
is
at
what
all.
it is.
No, I'm going pretty well.